Okay, so this is a really exciting week because we just passed 100,000 subscribers. I had no idea that this would happen. About a little over 2 years ago, I think I started the channel in December of 2023, essentially talking into my webcam in my home about protracted antidepressant and benzodiazepine withdrawal. Here we are, a little over 2 years later with 100,000 subscribers, and our content has been viewed 11.2 million times. That is simply crazy. I can't believe that statistic. And man, I'm so happy because I really don't see anyone else on social media who's super active about talking about psychiatric drug harms, psychiatric tapering. And the fact that 11.2 million people have stumbled across the channel and seen this content is just awesome. And my commitment to you is that I will not stop. We're going to keep on growing this, and we are going to be a leading voice in the critical psychiatry space, waking people up to the problems that are going on with these drugs, helping them come off them, educating other clinicians and mental health providers. And it's just crazy to be one of the leading voices in critical psychiatry online at the moment. And I'm just so lucky that I get to be the mouthpiece for all of the amazing work from other psychiatrists out there, from people like Mark Horowitz, Joanna Moncrieff, David Healy, citizen scientists like Adele Framer, and countless other folks who I can't remember right now, but I am standing on the shoulders of giants and people that have been doing this for a long time. And so in honor of us getting this far, I figured we'd do a Q&A of some really common questions that we've been getting. We posted this over in the community section on the YouTube channel. If you haven't found that, you can navigate over there, and we occasionally ask questions. And we got over 250 questions. I can't do 250. So what I did was I summarized them down into 20 main themes, and I figured we'd do a rapid fire Q&A of some of the most common questions that you guys are having at the moment. So number one, perimenopausal misdiagnoses. Why are so many women misdiagnosed with psychiatric conditions instead of being recognized as experiencing perimenopausal symptoms? And why is HRT often denied to them? This is incredibly common. Every month I have women coming to me who have been put on benzodiazepines or SSRIs because they have increased anxiety or insomnia from perimenopause. Why is this happening? Well, I think it's happening because the doctors think that the drugs are benign. They think, this is not like a super big deal. Yeah, you're having some symptoms, antidepressants, safe and effective, and they want to give you something to sort of get you out the door. And so I often find a lot of these women get put on these meds and they're not really given true informed consent, specifically as to the risks of them and how hard they can be to come off. And it's just a disaster. What kind of society does this to perimenopausal women who are usually at that time looking after children, looking after their parents, and then we saddle them with these medications that cause harms instead of doing other things such as HRT. Now, I'm not going to claim to be an HRT specialist. What I do know is that for many years, HRT was seen as a big no-no and that you shouldn't do it because it increased the risk of strokes and such. That evidence has now been refuted, and HRT is much more widely accessible now. A lot of people are doing it. I have friends doing it. I know several people with protracted withdrawal who are on HRT, and it has seemed to have helped them. And so I would get in touch with an OBGYN who is familiar with that if you are having perimenopausal symptoms, because I would treat your anxiety, depression, insomnia at the root rather than masking it with drugs. So question 2, how common is it for people to be misdiagnosed with a mental illness when their symptoms are actually caused by medical conditions, medications, or life circumstances? This is incredibly common. This is the main reason why I do this channel. Is because I was just disgusted by what I was seeing in training. And doctors they gave up. They gave up trying to find and address root causes for people. They had these 20-minute appointments, and they wouldn't even ask about life stresses or medical things and all of that. And so this is the main problem that's happening in American psychiatry today, is we've given up on looking for root causes. We diagnose with checklists, and then we treat them with protocols for drugs, but it's way more complicated than that. So this is, I'm going to say, I think this is totally the norm. I think a video is coming out soon where I say that only 5% of the people on psychiatric meds really ought to be on these days. So I think this is happening more than it should by like a factor of 20. Gut health. Is there a link between gut bacteria and mental health? How can someone improve their gut microbiome for better mental well-being? Yeah, there definitely is. Medical problems and gut health play a big part in your mental health. In terms of specifics, there are problems like yeast overgrowth that just generally make people feel unwell. You can also have Clostridia difficile infection as well in the gut. These things can be treated by antibiotics sometimes if it's severe, or high-dose probiotics. People also can have sensitivities to things like gluten. That's a big deal when it comes to things like psychosis. I think everyone who has a psychotic diagnosis should try a gluten-free diet. And also things like ketogenic diet as well can be really helpful for people with severe depression, bipolar and schizophrenia as well. And that's because of how it affects energy metabolism. The person to go and see, if you are someone who's interested in gut health and mental health, the person you go and see is a functional medicine doctor. If you specifically want someone who's got a tilt towards psychiatry, you can go to Psychiatry Redefined and you can look at their provider directory. And these people have been trained by Dr. James Greenblatt, who I think is super legit when it comes to functional medicine for mental health. And so that's what I would do if you are having digestive problems, maybe you're having some rashes or joint pain, anything suggesting that you're in a high inflammatory state, or you're having, you have food problems, and go and see a functional medicine doctor. Question 4, what are the lesser known side effects of ADHD medications? Well, I think the ones that most people recognize are kind of like the blunting and the loss of creativity and the kind of the dulling down. A lot of people will experience that. They're just like, I'm just not my spontaneous self anymore. And they're very focused. And obviously that's why these meds help. But other things that I think people miss is people can become irritable on the medication. Sometimes they crash in the afternoons as well, and they have irritability in the evening. There are problems with the Adderall type medications where they can cause high blood pressure also. And the thing that we worry about the most is actually manic and psychotic reactions, which kids are more susceptible to. They have a warnings and precautions for this. And so any kid on an ADHD medication who's acting manic or psychotic, it's not bipolar or schizophrenia, it's the ADHD medication until proven otherwise. What is the safest way to taper off medications, especially after long-term use? I love that you asked this. I have a video called The Beginner's Guide to Tapering Off Psychiatric Medications, which we do a little pop-up here. And then we also have the link to another video where we have our full 80-page comprehensive internal guidelines on how our team does this. It's more geared towards clinicians, but patients can also use it. And so we've got 2 really comprehensive videos that are going to answer that for you. What are the long-term effects of psychiatric meds? How do they change the structure and the function of the brain over time? One of the sad things about this is we don't really know for many of them. I mean, we know with antipsychotics that they cause brain atrophy, specifically in the frontal and the parietal lobes over time. And they can also cause things, like tardive dyskinesia. We know that, you can have medications like benzodiazepines that can cause neurotoxicity over time. In rare instances, there's drugs like lithium, where in a small portion of people, they can develop some cognitive impairment called silent syndrome. In general, most things I see improve. The things that I see that don't improve over time, unfortunately, are some people with PSSD and tardive dyskinesia. Aside from that, most of the drug injuries I come across gradually get better over the course of 1 to 2 to 3, sometimes more years once you remove them. I always tell people that that the brain has a tremendous capacity for neuroplasticity, and healing does take place. Yes, and sorry, I just want to add here, there are some people with PSSD and tardive dyskinesia, and it does go away. It just doesn't frequently resolve as much as some of the other problems. Okay. Psychiatric drug withdrawal. Why do some people experience protracted symptoms even after tapering slowly? What can be done to mitigate these effects? That's not what I see. I actually don't see people with protracted withdrawal symptoms after tapering slowly. Most of the time, I see people who have gone off the medications too quickly. They've sensitized their brain, and now when they try and taper slowly, it's really hard because they've really kind of sensitized it. So it's not something I see. When it comes to mitigating protracted withdrawal, the number one thing that you can do is to safely taper off your medication at a rate that your brain can adapt to. And be sure to taper like stimulants before you taper sedatives, because that can increase the risk as well. SSRIs and emotional blunting. How can someone assess whether their mental health is improving when SSRIs may be masking their emotions rather than treating the underlying issue? So this comes down to the question of, why are you depressed? So I think, I split it into two camps. There's the symptoms that are clearly linked to life stresses. And I think that's clear. Like if you're someone and you knew your anxiety was due to relationship problems or loneliness or dissatisfaction at work, or even something like poverty, you're going to know that those things are getting better because your life is improving and your life situation is improving. But when it comes to symptoms that seemingly come out of nowhere, generally, I think that the main culprits there are things like medical problems and diet. The drugs are not going to fix those things. So I think when you address like medical reasons and dietary reasons, that for your symptoms, they generally get better. So when it comes to coming back to that question, how do you know whether it's improving your mental health rather than treating the underlying issue? SSRIs don't work on any underlying issue. There's no chemical imbalance. They're essentially a drug with a drug effect that masks symptoms, and we should only be using them after we've tried to treat the root causes. And if we can't find anything, then I think we just go for it. It's just something that if you understand the risks, you can use. And so these drugs don't really treat any underlying conditions. Birth control and mental health. How does hormonal birth control impact mental health, and are its effects similar to psychiatric meds? So, well, I don't think they're similar to psychiatric meds. Hormonal birth control oftentimes acts as a gateway drug into the mental health industry, because you get young women who are having painful periods. They get told, you can just sort of like biohack your physiology and avoid periods, and also, not get pregnant if that's something you're trying to avoid. But it causes mood lability, and it makes people like emotional and tearful. And then doctors miss this, or they write it off, or they think, what's the big deal? We'll just put someone on SSRI. They're safe and effective. And then before you know it, that person's on an SSRI for no reason, essentially treating a drug side effect. And then things spiral out of control. They get dependent on the medication, and then they can end up getting a bipolar diagnosis or something like that if they have side effects. And so, have a high suspicion of drug worsening your mood if you're on hormonal birth control. It's a big thing to be wary of. Alternative treatments for anxiety and depression. What are the natural or holistic alternatives for managing things? Man, there's so many things. Again, that video on the beginner's guide to coming off psychiatric meds goes into this a lot. It's broken into life stresses and medical reasons as the main things that cause anxiety and depression. And so for life stresses, relationship problems, sometimes that just takes time. Sometimes you may want to see an interpersonal therapist. If you have a history of trauma, a brief stint with a trauma therapist to understand how that shapes your personality and maybe affecting your relationships can help. If you've got work problems, you may need to go back to school, or you may need to see a career coach, things completely out of the mental health industry. And so those things can be really helpful. And sometimes if you're just in grief or bereavement, you just need time and support from loved ones. When it comes to other things you can do, dietary modifications are awesome. Go to a whole foods paleo diet that eliminates common food sensitivities like gluten, soy, dairy, and processed food. You only need to do it for a couple of months before you can sense whether it's actually helping you. I think that's always worth a shot. And then seeing a functional medicine doctor to make sure that there's no medical or nutritional reasons why you're unwell. That's where I would start. And then there's also, meditation, breath work, breathing. And this is, and you just have to try something. You just have to try them until you find something that's the right fit for you. Exercise is an important one as well, especially for men. We are bred and genetically meant to be very active. And when we get too sedentary, that can lead to anxiety and depression. So there's a whole range of things that you can try. 11, psychiatric drug-induced violence. What do we know about the potential link between psychiatric drugs and violent behavior? including mass shootings. Well, I think it's common sense, and I know this will make me sound crazy, but we have had court cases where juries have found that the drugs made people suicidal and homicidal. For instance, Donald Shell in Wyoming unfortunately killed his daughter and his granddaughter, and then himself, while in a drug-induced psychosis induced by Paxil. They sued GSK and won for failure to warn because they weren't told that the drug could cause suicidal because they weren't warned that the drug could cause suicidal and homicidal behavior. There was another case, I think it was in Washington, the Westbecker case, where a man went to a printing factory and gunned down several employees. It looked like the drug wasn't involved, but then it was found out that I think it was Eli Lilly actually settled the case privately with a bunch of the people who brought the claim forward to kind of have it sealed. And so that's super suspicious as well. We do know these drugs cause people to become suicidal as well. They can cause paradoxical reactions that make people depressed and dysphoric. They can make people blunted. There's a warning on there there's a warning on the drug labels that it can make people manic and psychotic. And, when people are manic and psychotic, they're not in their right minds. And if they're impulsive, which is a state in mania, yes, this can lead people to be violent and aggressive and potentially murder people. David Healy did a really great BBC documentary called A Prescription for Murder, which is kind of hard to find. It's available in the UK, but essentially it details his evaluation of the Aurora shooter, James Holmes, who gunned down several people in a movie theater. And it looked like he was having a drug-induced manic episode, and which kicked off after his dose was increased. And if you just look at photos of James Holmes from when he was arraigned, he has like red hair, wide-eyed. This was not someone that had a history of like mania or psychosis, and it happened shortly after he bumped up on the drug. Because the death penalty was on the table, it looks like the defense decided to not pursue a drug like a Prozac defense, saying essentially the drug made me do it, because they thought, I imagine, now this is speculation, I imagine they thought that it would look like he was avoiding responsibility. And so they didn't do a drug-induced defense. They actually went for not guilty by reasons of insanity, and he was able to avoid the death sentence. Mass shootings are so taboo and so sensitive that I think after they happen, a lot of the records are sealed. Families, they don't want to say things like the drug caused it because their communities already absolutely kind of hate them, and they're trying to keep a low profile, and they just want to move on with their life. RFK wants to look into this. He wants more data on it. People who have looked into this, who say that there's no link between them, when you look at the research papers, essentially what you see is that the quality of the data is poor and everything is redacted, and they don't have access to the actual reports. And so I think people pretend that this is set science and that it's not happening, but really I don't think people are looking at it. But common sense would tell you that yes, if you take drugs that cause mania and psychosis, they could make people do violent things. Okay. The role of functional medicine in psychiatry. How can functional medicine approaches such as diet, supplementation, and lifestyle changes help in treating mental health conditions? I think I've kind of covered this. All of these things help. Diet can treat things at the root cause. There's many supplements that are a lot healthier than psychiatric medications. They kind of work like psychiatric meds sometimes. For instance, there are things such as lithium orotate and magnesium, which really do act like drugs. They are used at much lower levels. They're much safer, and people tend to have less problems with them. And so you may choose to kind of use them as drugs, but as safer drugs. And then obviously lifestyle changes like exercise is really helpful. All of that stuff is really great. See a functional medicine doctor. TMS and non-drug interventions. What are the risks and benefits of TMS? I'm not that much of an expert on the efficacy of TMS, but from what I hear, it is not that effective. It doesn't quite get the same efficacy as some of the other things like ECT, which tends to be a bit of a heavy hitter, and it causes more, and it seems to, quote unquote, reduce more symptoms, but kind of masks them, because I think it's causing effects in the brain, which can be dangerous for some people, and they mask symptoms. What I do know about TMS is that there's a whole Facebook page called, I think it's like RTMS Recovery, and it's for people who have had essentially a concussive style brain injury from the electromagnetic impulses from TMS, and they're having a whole range of brain injury symptoms. And so it's not harmless. I think it's sold as harmless, but it really isn't. Next question, paradoxical reactions. Why do some individuals, particularly on the autism spectrum disorder, have paradoxical reactions to the meds? It's not just people with autism spectrum disorder. I would say it's anyone who has a neurological vulnerability, people with epilepsy, people who have had prior traumatic brain injuries, sometimes people who are just genetically susceptible. I think the more hits you've had to your nervous system, and the more conditions you have, and sometimes even the more drugs you've been on, or the more difficult withdrawals you've had in the past, all of these things place you at a higher risk of having adverse reactions to psychiatric meds and other drugs. 15. What are the ethical concerns around forced meds and psychiatric hospitals? And are there effective non-drug approaches? Yeah, there's horrific ethical concerns with these things. Oftentimes, people who are seen as just being disruptive to society, there's nowhere to kind of put these folks, and so they end up essentially just going into psychiatric hospitals, and then when they become irritable at being there, they get force medicated. I've seen also, this is awful, some parents, when they have difficult kids or spouses, or there's a difficult person in the family and they don't know how to deal with it, they just go, I just have to send them to the psychiatrist, and then the psychiatrist is like, they have a mental health condition, and all of a sudden they end up getting medicated against their will. The sad thing is there are no places where you could go to get be treated for like a severe mental health type of problem, like a psychosis, without getting meds. There were some pilot programs, I think, in places like Finland, but they lost funding. And this is a big gap in the market at the moment, where there's essentially no option for people to get drug-free mental health treatment if you want to avoid forced medication. So that's really nasty. Benzodiazepines. What are the best strategies for safely tapering off benzos after long-term use? Why do some people struggle so much with withdrawal? So again, I direct you to the beginner's guide for tapering off psychiatric medications. Why do some people struggle a lot with withdrawal? What I would say is some people genetically are just very sensitive to it. Some people don't understand how slowly you need to go at the end because of the hyperbolic tapering and the way the drug disconnects from the receptors. And so they get tripped up there. And some people have a hard time coming off because they have multiple hits to their nervous system. They've done several withdrawals in the past. And they've almost kindled themselves. They've sensitized themselves, and now their nervous system is super raw. And so when they try and taper off, they sort of feel every reduction. 17, psychiatric meds for physical conditions. Are antidepressants and other psych drugs actually effective for physical conditions like fibromyalgia, chronic pain, and migraines? They don't treat them at the root cause. Essentially, they simply mask those conditions. And that's essentially it, unfortunately. Question 18, insurance and access to safe tapering. How can patients navigate the healthcare system to access safe and affordable medication tapering? Yeah, great question. There's a lot of, so this will depend on where you are. I'll focus on the US. So in the US, there's a video I've done recently about how to find help for tapering. Sometimes you can find professionals who will do this. Sometimes they charge hourly. Sometimes they take insurance. If you are wanting to use your insurance, unfortunately, you have to be self-educated. And that's what I hope this channel does. So again, check out our tapering documents, the big 80-page one, and also our beginner's guide to tapering. And you can use those with your doctor. But I have to say, it's hard to find now. And most doctors aren't trained on how to safely taper people. Microdosing psychedelics. What's the current research on microdosing psychedelics for anxiety, depression, and PTSD? So I want to separate this out. I think the research on this is kind of shitty because the FDA has decided to do placebo-controlled trials, and they're like pretty uninspired, and they go, well, everything else we've done is placebo-controlled. And that's kind of silly, right? Because how could you do a placebo-controlled trial for like magic mushrooms, and they're taking them at full doses. I mean, if you took the placebo, you'd know you didn't have it. And so anyway, they've done these studies now, especially with MDMA for PTSD. And when they went to try and get it approved, they said, well, we don't really think this is blinded properly. And it's like, yeah, no, duh. The design is off. Some countries have completely sidestepped this. I know Australia just went out and just straight up legalized. I think they did MDMA and psilocybin for severe depression and PTSD, or maybe it was just PTSD. I can't quite remember. The US is still trying to figure out the pathway to get these drugs onto the market. I think that's going to happen soon. My general take on this is obviously nothing is completely safe. Some people who get exposed to psychedelics have a neurotoxicity and they develop HPPD, hallucinogenic persistent perceptual disorder, but it's very rare. So it's not benign, but I like the idea of, and this is how they use psychedelics, of doing therapy, identifying problems you're struggling with, taking a psychedelic, working with a therapist to gain new insights into it, and then doing integration sessions afterwards to take what you've learned from your trip, essentially to improve your life. These aren't drugs that, these aren't drugs that are at least being approved for daily use for anxiety and depression. So if you only needed to use it maybe a couple times a year, that's better than a daily psych med from my perspective. Oh, just realizing. So this question was about microdosing. With respect to microdosing, again, I would say I'm worried about it. I'm always worried about anyone taking a psychiatric med on a daily basis. I think you get dependent on it. I think it could also be toxic to the brain long term. And so I think microdosing, like every now and then, is fine. I would be really hesitant about using it on an ongoing daily basis. And finally, public awareness and advocacy. How can individuals and professionals spread awareness about the dangers of over-medication and advocate for better mental health care? Talk to your doctors. Bring them my videos. I have doctors who sort of bitch about me on Facebook pages, which I'm a part of. They're like, how are you dealing with, these RFK style doctors who are telling people to come off meds, and then they'll post like a clip to my video. And some people are just like, this guy's the worst. And other doctors are saying, no, I've heard about this. I know these problems are bad. Keep on talking to doctors about it. It happens at the grassroots level. Talk to journalists, spread the word about this stuff. The more we talk about it, the more you talk to others, the more it will enter the public domain. And so that is the 20-question summary of those 250 questions that we got. Hope that was helpful. Ask me anything. If you have any more questions that I missed, comment below. My team will put together another Q&A. And finally, thank you for supporting me and getting the word out about psychiatric drug harms. I love making this content, and I love that you're supporting me. So thank you so much, and we'll see you at 1 million subscribers. Let's see how long that takes.